and good morning, and welcome to this 2021 Arizona State of Reform Health Policy Conference. My name is DJ Wilson, one of the hosts here, bringing you today's event, and we're super excited and honored that you're with us, honored that you're allowing us to play this role in Arizona healthcare as a convener and a platform to have some of the smartest people in healthcare in Arizona join us for conversations and engagement with you and with other speakers. So we're excited to kick the day off. I want to just run through a little bit about state of reform, the sort of kind of context and approach that we bring to this conversation here today, and then point us towards some of the folks who have helped make all of this happen, sponsors, our community panel members, some of our speakers, et cetera. And then we'll jump right in with our morning keynote conversation. To begin, if you have been engaged with us in some way, or if you've been reading our stuff, you know we think of ourselves as sort of this bridge between the world of healthcare and health policy. And we do that, of course, through our convenings like this one in the virtual space, or in the before times, the in-person space. And of course, in the future, hopefully very soon, we'll be back in person. We also do that, of course, through our content and our reporting. So you can see that we have been continuing to grow our coverage of state-based health policy and healthcare across Arizona, but also across the country. We're now in 15 different states, if you can believe that. It's crazy to hear me even say, but we think of our approach to news, something like the old documentary that many of you may recall, Super Size Me, about the fast food industry, and kicks off this slow food movement where, you know, we are reminded that a slower food experience allows us to build relationship and to pull ourselves together in community to support one another. It's healthier for our body than fast food, even though fast food might be easy. And of course, we think of that in terms of slow news as well, that slow news is better for our body politic, and that if we have too much fast news, we're actually not creating the bonds that we need to hold our American Republic together. So we think of our role as a bridge builder in both the in-person setting, the virtual setting, of course, through our content as well. Part of sort of the kind of background of this and the sort of thinking goes back to this old movie from 1990, Memphis Belle, about airmen who were on their 25th bombing mission over the European theater. And of course, for some of our Air Force guys, Len and some others in the room here with us, they'll recall that 25 bombing missions was the maximum for a squadron. And so they were on their final mission, and they read this prayer before they took to the skies. And the whole movie is about them going and coming back. And the prayer was not actually a prayer. It was a poem, actually, by Yeats, Ireland's favored son, and titled "The Second Coming," which of course was a Revelations reference in the biblical reference. But it was a poem actually about the failure of leadership leading up to World War I and the cost of that failed political leadership. And so Yeats writes in The Second Coming, "Turning and turning in the widening gyre, the falcon cannot hear the falconer. Things fall apart. The center cannot hold. Mere anarchy is loosed upon the world. The blood-dimmed tide is loosed, and everywhere the ceremony of innocence is drowned. The best lack all conviction, while the worst are full of passionate intensity." So when I think of our healthcare politics, I think of this period, at least since the beginning of the Affordable Care Act discussion in 2009. And I think about Yeats's poem, not in terms of partisan thinking, as you'll see here in a second, but just the center holding and our institutions holding the importance of that there are some that are full of passionate intensity, but that our job is for the falcon to hear the falconer. And so I recall back to Facebook posts about death panels in 2009, which of course helps frame the election for 2010, which is the strongest I would say, one of the strongest midterm elections ever. Republicans shellacked Democrats, and they were motivated and mobilized because of health policy. People who took to the polls because they cared about health policy and they were worried and they were fired up and they voted as a result. We see that not just, of course, in 2010, but that becomes manifest in our 2016 elections. And of course, this vote in 2017 in the House of Republicans to repeal the ACA is a continued manifestation of that. It falls short in the Senate, as Arizonans will recall, because of the decisive vote by then Senator John McCain. But that fear and the anger and the uncertainty, the widening gyre, continues to become manifest in 2018. Where now Democrats have 8 million more votes for congressional candidates than Republicans do. And so it's sort of the pendulum swinging back and forth, regardless of one's politics. This isn't a comment about ideology. It's a comment about how maddeningly volatile our politics are right now. And that becomes manifest in our elections, and it's in significant part because of healthcare. Just as it was in 2010, in 2018, Democrats were campaigning on healthcare. And of course, voters cared and voted because of healthcare in that election. And it's not just those midterms, of course. It turns out that even now, today, a plurality of Republicans support, according to at least some public polling, revolutionary positions that would do away with our healthcare system. Simple answers are becoming more palatable. And because we all work in healthcare, we know that simple answers like those espoused here, just doing away with healthcare, those simple answers are never going to be, they're never going to get us where we want to be. So the politics of our time, one day they are left, one day they are right, one day we take 2 steps forward, we take 2 steps back, and Yates's words sort of underpin our approach here at State of Reform, trying to create a space, a table where any credible voice can come and engage, and we can wrestle with the complicated details of our policy and politics. I want to just sort of like underscore one point and then put a little bit of meat behind it. And I think if we take all of this together, when you are leading your organizations, whether they're at the Department of Human Services or at Access or any state or private agency, we can see that things usually move more quickly than they should, right up until, they usually move more slowly than they should, right up until the point at which they move more quickly than they should. That's sort of how our politics and the winds of change blow. But it's when things move more quickly than they should that sometimes things can break. So it turns out there's a science and data that underscores this stuff. It's not just a thing that we intuit. It's not just a sense that we feel like it's been a hard couple of years and maybe a couple of divisive elections. It turns out that there's this whole study called cliodynamics, which takes quantitative data and applies them to qualitative historical experiences. The sort of godfather, the person who underpins this new area of study, this new area of research, is a guy named Peter Turchin, who's written a couple books on the topic. Sure to put you to sleep if you are the hardest core insomniac or political geek like me. But he pulls a bunch of data and he reviews history and republics like ours and talks about how we are seeing an erosion of trust in government. We know that, we feel it, but it shows up in the data. We're seeing a real spike in income inequality. We know that, we feel it, we can see it on the streets, but it turns out that is empirical as well. And it turns out that if you're watching today, you're probably in the top 10% of income earners. You're probably, by definition, even though you don't think of yourself as an elite, if you're in the top 10% of income earners, you're probably an economic elite. You're probably leading organizations. You're probably helping to shape policy. You're probably helping to shape market activity. And put a pin in that because I want to come back to it here in a second. We also see that our sometimes our government, particularly at the federal level, is not working like we would hope it to. This is a slide that shows the use of the filibuster in the Senate and how we are now sometimes getting up to 70% of issues before the US Senate now have a filibuster threat and challenge. So it turns out it even shows up in our literature that we now use words like greed more than we ever have. We use words like cooperation half as often as we did 60, 70 years ago. This is from Google, of course. Turchin cites it, which is where I got it. But Google, of course, has indexed all of the words in the English language literature and other language literature canons, and can tell you the number of times words are used across different outlets. So you take all of this together, and Turchin charts this sort of well-being index and a political stress index. And he writes in 2010 that the pathway that we are on in the United States gives us quantitatively about a 25% chance for an insurrectionary moment in the next 10 years, an insurrectionary period. And that's back in 2010. And he says the three things that have to happen to hold a Republican democracy like the American one together are or the three things that would happen are this a rise of income inequality, something that we see in our data. We'd have to see a erosion of the trust in government, and we'd have to see an inability of elites to solve problems. Those are the three things that have to happen for a society to fall. And it turns out, our job here today, our job at State of Reform, is not to solve income inequality. Our job, your job, you don't come here to try to solve trust in government, or not everybody does. But what we do here at State of Reform can help you do your job of improving the healthcare system for our community. If we just all do our jobs, if we just play our role, if you just keep doing great work and leaning into challenging, hard to solve problems, that is what we can do to keep our American democracy together. And when we think of insurrectionary moments, we can have faith and trust that if we just do our job, we will help hold it all together. To do all this, for us to play our role, we have to have sort of the wind in our sails from four different types of stakeholders. First is sponsors, and Beacon Health Options is our event sponsor for today. They've been the best partner in terms of trying to figure out how to manage behavioral health in Arizona, and of course in other states, with experience working with health plans and counties and Blues and MCOs and Medicaid, and really across the board. They are a top-of-class organization, and we're super honored that they are putting wind in our sails. Likewise, Health Management Associates, Mercy Care, they are some of our major sponsors, as are United and Gemini Health, great organizations doing really important work in Arizona. And of course, Vitalis Health Foundation, another one of our major sponsors, with others who have been, like I say, putting wind in our sails. Our convening panel is a group that's a second area of stakeholder engagement that we need to be successful. These are the folks who have helped us build today's agenda, who have said, hey, you know what, we should hear from Dr. Cara Christ, which we'll do here in just a second. We should talk about these topics in these ways, framing them so that they can be as constructive as possible, so that your time with us today, and when you come back and watch us on demand, which you can do anytime for the next 30 days, those conversations will be meaningful and important. So this convening panel is really the chassis on which all of State of Reform rides. So thank you to those folks. We also have just shy of 60 speakers here today. If you have folks who, if you're going to have folks participate in a conversation, you need to have them be willing to show up, and a lot of folks have. And then finally, we've got, I think it's actually going to end up being closer to 250 after folks are registered here this morning, but 223 last night. I think we're now at about 235 this morning with additional registrants. So thank you all for showing up. That's it. Let's jump into it. You didn't come here to hear from me, I know. So I want to jump right into our keynote conversation with Dr. Cara Christ. She's, of course, the director and leads the Arizona Department of Human Services. And I've got your slide deck there up. Dr. Christ, thank you very much for making time to be with us.
Thank you. And very nice words this morning. And I hope we don't lose the word cooperation or collaboration from our vocabulary, because that is actually one of the things we have relied on during the pandemic. So good morning, everybody. I'm Dr. Cara Christ. I'm the director of the Arizona Department of Health Services. And today I'm going to provide some insight into ADHS's perspective on COVID-19 in Arizona, talk about some of the lessons that we've learned along the way and where we are currently and things to look forward to. But before I launch into my slide, I just want to take a moment to say thank you. A lot of you I know are in healthcare and public health. So thank you for being on the front lines for the last 16 months. And thank you for caring for our patients and taking care of our grandmothers and grandfathers and being part of the COVID-19 pandemic response. I want to thank you for working nights, weekends, and everything in between in service to all Arizonans. So let's start with how it started. I'm sure many of you remember the early days of the response. My team can tell you exactly what they were doing when each of us found out about our state's first COVID case. ADHS maintains a 24/7 on-call system, and our epidemiology and laboratory teams are always thrilled to respond to exotic or emerging infectious diseases. They get to work on these extraordinary types of cases. Of course, during that initial weekend in January and the weeks that followed, we had no idea what this would morph into, eventually a global pandemic. You'll see in the picture on the top right that that's our Health Emergency Operations Center, or our HEOC as we call it. We activated it near the start of the pandemic in January. We activate it whenever there's a response that could require multiple areas of the agency to respond, so that we get that coordination and that collaboration through all parts of the department. Usually it's operational for days to weeks. It is still operational now from over a year ago, which I'm sure is not a surprise to anybody. Like any novel outbreak or disease investigation, our epidemiology and laboratory teams took front seat in this investigation. They worked with federal and local health partners to identify new cases of disease through testing and making recommendations to prevent disease transmission based on the information that we had at the time, which was not very much with this novel virus. In the background, we were identifying and preparing tools that we may need for the pandemic, including our public health emergency response plans and looking at statute to identify how we could potentially issue isolation and quarantine orders and enhance surveillance authorities to give us improved data collection. And you'll see from the pictures on the bottom, we were conducting one of our other most important tasks, which is keeping the public informed through news releases and press conferences. At the beginning of the outbreak, none of us were sure how big or how severe COVID-19 would be, or what recommendations were the right ones to prevent spread of disease. There were many, many challenges that we faced. There were so many unknowns that we all had to navigate through while trying to provide as much information to the public as possible. We were faced with supply chain and personnel shortages while trying to prevent disease transmission and save lives. In the beginning, there wasn't enough of anything to appropriately respond to the pandemic. Everyone dealt with PPE shortages. There weren't enough N95s, gowns, gloves, or face shields. Most of you will probably remember that there weren't any in-state tests to identify whether people even had COVID-19 at the beginning. Once there were tests at our state lab and our commercial laboratories, there weren't enough nasal swabs. And once there were enough nasal swabs, there wasn't enough lab capacity. Partnerships became critical. Partnerships like ASU, Sonora Quest, and LabCorp, they were crucial in filling those gaps. We worked with our hospital partners to ensure that there were enough beds, but quickly found that during surges, it wasn't the shortage of beds that caused us potential problems. It was the shortage in staff that were able to care for the patients in those beds that limited our potential hospital capacity. Finally, when the vaccine arrived, there weren't enough doses to meet the demand. Developing partnerships with healthcare and community partners allowed us to quickly problem solve and fill gaps in each of these areas. I'll walk through a couple more areas to highlight public health's role in a situation like this. So at the bottom left of this slide, you'll see an example of our earliest dashboard showing our evolving efforts to present the data in a clear and concise manner that's understandable to the public. The dashboard has dramatically evolved since then to show additional data on hospital indicators and vaccination coverage. It's now the most visited webpage on our website at ADHS, but it took a while to begin collecting all of the data, identify what data we need, and what was the best way to present that data. We've been through multiple renditions of the data we collect and the best ways to display that. And the data is really important because it allows us to identify and better understand our communities that are most impacted and target strategies to improve health outcomes. Last spring, in an attempt to boost testing, we launched the Arizona Testing Blitz, which many providers around the state participated in. This was the first time in the response that ADHS contracted directly with community providers to provide our own health service. It was launched to increase access and to normalize testing and improve detection of COVID-19 in our communities. It had occurred at a time when specimen collection supplies were scarce and laboratory turnaround time was long. Now we have pallets of nasal swabs in our warehouse and plenty of capacity in our labs. But at that point, my team was taking counts daily from providers to get swabs couriered out to support those testing events. Other innovations implemented nearly a year ago include healthcare-specific innovations. Early on, our medical director foresaw the potential of a significant hospital surge and conceptualized the Arizona Surge Line, which was built to ensure that patients in Arizona were able to receive the right level of care at the right time, no matter where they lived or presented in Arizona. This service has become a national model and has facilitated over 6,900 transfers since its inception, and it covers both the cost of the transfer, both to and from the receiving facility. It's also implemented several offshoots to support the healthcare system during the pandemic, including the Surge Staffing Initiative, which has provided over 900 nurses to hospitals across Arizona, the Post-Acute Care Capacity Tracker, which allows hospitals to gain insight into available beds at nearby facilities and to facilitate timelier discharge to lower levels of care, and the Isolation Alternative Care Site Program, which facilitates the transfer of a patient from a hospital to a lower level of skilled nursing or behavioral health care to help decompress our hospital systems. All of these were desperately needed in Arizona during the healthcare surges. Their success demonstrated the innovation and cooperation of the Arizona public health and healthcare systems. As we've come through the pandemic, we've learned lessons and taken steps to avoid experiencing the same issues. You'll see the photo in the center of the slide showing one of our warehouses. Arizona has purchased millions of N95 masks, gowns, gloves, and other PPE items that have passed through our warehouse, in addition to gallons and gallons of hand sanitizer, hundreds of ventilators, hundreds of thousands of nasal swabs, and rapid test kits. While ADHS is prepared to order, receive, and distribute products in response to an emergency, this has never been done at this level or for this sustained amount of time. Partnership with local health departments supported the further distribution of these products to workers on the front lines and facilities all around the community and to our frontline essential workers. This warehouse now holds a supply of PPE for all healthcare facilities in Arizona to get us through future shortages should they arise. And ADHS and local public health continued conducting case investigation and contact tracing and issuing guidance for the public, for healthcare facilities, and for settings like businesses, schools, correctional facilities, and faith communities. Every segment of our society was interested in getting their own specific recommendations, and in a way that was simple and streamlined. We do have more work to establish community partnerships with different sectors that will allow us to expand our reach through these various groups and to amplify our messages. So currently, we are in a much better place today than during the first few months of the year and the rest of the pandemic. About 877,000 Arizonans have tested positive for COVID, with about 9.6 million diagnostic tests performed statewide. We've experienced 2 surges in cases, one last summer, and then again this winter, with high numbers of admissions to inpatient and ICU beds. Cases, along with demand for hospital and ICU space, have dropped substantially over the past few months and have remained relatively level for weeks. Public health has worked very hard over the past year to increase access to testing and vaccination. As you can see from these maps and graphs, both testing and vaccination sites are now widespread through the community. And our ability to test and vaccinate Arizonans has increased significantly since they were introduced. Currently, we have over 1,600 providers that have received vaccine across the state, including almost 1,000 pharmacies. Nearly 5.8 million doses of COVID-19 vaccine have been administered to 3.26 million people, of whom 2.75 million are now fully vaccinated. Having over 45% of Arizona's population vaccinated reduces the chances of a spike in cases and, more importantly, stress on our healthcare system. In order to add additional capacity, at the beginning of January, we started up state-operated vaccination sites in addition to all of the work our local public health departments had done. To date, over 1.5 million vaccine doses have been administered at these sites. With those ages 12 to 15 now eligible to receive Pfizer vaccine, there's even more opportunity to increase that percentage towards herd immunity. If we can continue expanding vaccinations through more focused efforts that reach deeply into communities to meet people where they are, we will be able to avoid significant surges in cases in the future. Unvaccinated people remain at risk for severe outcomes of COVID-19, which remains active in our community. People continue to get sick and die from COVID-19, which is especially unfortunate given that Arizona has more than enough supply of vaccines that are proven to protect people from hospitalization and death. To protect our communities, we've worked to expand our strategies. We've launched a vaccine influencer campaign that runs on TV and social media and pulls in diverse representatives from across Arizona, and we have more planned. We've seen a range of settings for vaccination sites with more planned, from Gila River Arena to pop-up events at a local community or school. We've just awarded contracts to 12 partners who can take vaccinations on the road and set up special events in convenient community locations identified by local public health and community leaders. Our plans continually evolve to meet the needs of our citizens. With vaccine supply now exceeding demand, ADHS is working along local health departments and community organizations to promote vaccination in the community. We've made it easier for doctors' offices and local healthcare providers to get vaccine by enabling them to order directly from our federal government. Hundreds of pharmacies and providers have vaccine around the state, often on a walk-up basis. And we have commissioned intensive outreach efforts in underserved areas of Mesa, Phoenix, and Yuma County to try to overcome vaccine hesitancy by answering questions and helping people locate a provider with one-on-one service in some cases. CDC recently introduced new guidance for fully vaccinated individuals. This allows those who are fully vaccinated against COVID-19 to resume most activities without a mask or physically distancing. It also allows them to travel domestically without obtaining a test or having to quarantine. Hopefully, this serves as a huge incentive for getting vaccinated for those who are still on the fence. So where are we going? As we look ahead to what's next, everyone keeps talking about a return to normal. In light of COVID-19, we have to consider what we want that normal to look like. How do we use health equity to ensure that we are having positive outcomes for people who are disproportionately affected by COVID and other health conditions? This points to the expansion of the work we've all been doing to address social determinants of health and the dire need for continued integration across sectors, public health, Medicaid, housing, education, so that we all work together on common goals. Taking vaccine deeper into the communities will be an increasing focus in the coming months. Arizona has come a long way since December, but in some ways, the difficult work is just beginning. We are committed to working alongside all partners to move Arizona toward community immunity from COVID-19, and it's never been easier to get vaccinated against COVID-19. And for those of you who aren't familiar, I also want to take a moment to introduce the Arizona Health Improvement Plan. This is a 5-year strategic plan which describes how ADHS and community partners work together to improve the health and wellness of all Arizonans. We recently wrapped up the previous iteration of the plan and now are embarking on the next rendition, with priority areas guided by the data collected and presented in the state health assessment. The 5 priorities for the 2021 to 2025 cycle are mental well-being, health in all policies and social determinants of health, rural and underserved or urban underserved health, pandemic recovery, and health equity. Each of these priorities has its own work group co-chaired by an ADHS staff member and one or more community partners to address the area's goals and strategies. The work of the Arizona Health Improvement Plan intersects with the work that all of you do every day, and I encourage you to get involved if you are not already. The pandemic has certainly exacerbated all of the health outcomes that the Arizona Health Improvement Plan areas of focus will work to address. A positive outcome from the pandemic is the partnerships that we developed and strengthened during our work together during COVID-19. This will allow us to more effectively address those priority areas. So I'm so encouraged to see all of you and our other public health and healthcare partners continue to fight for the health and wellness of Arizonans. And I'm excited about the other community members who have come forward in support of health. I know that after we take a second to catch our collective breath, that we can do great work together. And so thank you so much for the opportunity to speak today. I'm appreciative of all that you do for our communities and your unending service to the people of Arizona. So thank you.
Well, thanks for all of those comments. And let me just first apologize for getting your agency incorrectly, I think maybe twice. So sorry, it's obviously, I don't know why I had that mistaken, but I appreciate your comments here today. So let me just ask you, how are you holding up? Like as a leader and, being on the very tip of the spear on this, how are you doing?
We're doing well. I think had the vaccines not come out in December, I think that would have been just the depths of despair. It was a very, very long year. I am very fortunate to have a fantastic team here at ADHS that I enjoy working with and shares my same passion for serving the community and, ensuring the health and wellness of all Arizonans. So that has definitely made it more palatable as we've gone through the pandemic, is just having them around to be able to bounce ideas off of, to work together with, and we've become closer even during the pandemic.
Yeah. How do you think about the mental health recovery from this experience? That's obviously one of the pillars of your plan moving forward. It was the first on the left of your slide there. How do you think about sort of easing the population and individuals back to a less anxious space?
That's a great question, and something that the steering committee for pandemic recovery has talked about. There's going to be a lot of post-traumatic stress experienced because of the pandemic. People are going to have concerns about their safety and their health. And so we've talked about how the pandemic has exacerbated some of those things that can harm mental well-being, such as isolation, depression, worrying about finances or your health. So we're going to be coming out with some campaigns and some strategies to help people cope. We will be releasing a social connectedness campaign here in a bit to encourage people to become connected. It doesn't always have to be physically, but there's ways to stay connected with your family, your friends, and your community, and really encourage people to become connected again, because that's going to be the start of that. But that is a huge component because we know that we saw increases in opioid deaths during the pandemic. We're hearing of behavioral health, significant increases in behavioral health admissions and those types of things. So we want to make sure that we're protecting the mental well-being as well as the health of all Arizonans.
What are some of the lessons in terms of community level engagement vis-a-vis public messaging related to the vaccines? How have you sort of learned, how has public health learned through this process about how to engage communities in different ways to make sure that they are aware of their opportunities for vaccination and that not everything you hear about vaccines is always accurate?
Yes, and that is something that has been an important lesson learned throughout the entire pandemic. What we've found as we've been working on increasing vaccinations across Arizona is that those community partners are key. We can't reach everybody in Arizona as much as we'd like to or as much as we try. But what we identified as we were doing community listening sessions was that patients were going to trust their healthcare provider, or they were going to trust family members and friends or community leaders that had received the vaccination and could talk about their experience. So we've engaged healthcare providers. We've created toolkits on how to talk to your patients and encourage them to get vaccinated. But we've also engaged community leaders in our African American communities, in our Hispanic populations, to talk directly to their communities and talk about why it's so important they get vaccinated. Just this weekend, we launched the door-to-door efforts of our Phoenix City Council District 7 and 8 initiative. And so we had people from the community going door to door to talk to people and answer questions and help them register or bring them over to our vaccination site, which was located in the community, all in an effort to engage in increased vaccination.
Len Kirshner, former Access Director, he says, public health has traditionally been underfunded and that COVID has opened a flood of resources, but how do we continue supporting public health post-COVID? What are your thoughts on how, obviously there's money, but are there other ways or strategies that the healthcare sector can support public health?
I think that what the pandemic has shown us is that we are all part of public health, whether you're in the healthcare sector, officially public health, you're a community organization, everyone plays a role in ensuring the health of our communities. And so, becoming engaged in things like our Arizona Health Improvement Plan, taking up action items that can assist. You're right, we're getting a lot more money than we had in the past. We have been historically underfunded for decades. We definitely now are looking at how we're going to improve the infrastructure. But I think that's going to require us to look at public health differently. And how do we bring in the healthcare sector, our health plans, work more hand in hand with Medicaid, because we know that those populations are disproportionately affected by not only COVID-19, but ongoing health conditions. And so really bringing the whole community together and getting everyone to understand that they are all part of public health.
Build on that a little bit. How do you see public health or maybe state government in general different as a result of COVID? How will we employ these painful and hard-earned lessons? You want to keep kind of running with that?
Yeah, so a couple of the things that we've been brainstorming here as we're looking at grant opportunities from our federal partners is embedding public health into community locations. So part of that, embedding into our schools. They've lost a lot of their school nurse infrastructure. And so supporting the schools to be able to provide, information to their parents and their families on managing disease conditions, getting vaccinated, keeping your family and others healthy, and keeping their school communities healthy. So building out a school health infrastructure, looking at how we connect directly with our healthcare sector. We knew that we had worked with them previously during 2009 on making sure that they had PPE. I don't think anybody anticipated the level of shortages that we would have. But that is not the only time that we engage with the healthcare sector. And so really working with them to develop new innovative strategies on how we can keep people well and potentially out of the hospital by looking at rules, developing infrastructure to support some of those types of facilities like our residential facilities and long-term care, so that they have connections to public health for when they're facing outbreaks or PPE shortages. It identified a lot of gaps that we're going to try to build infrastructure to make sure that we are connecting with them and are able to respond quicker during the next emergency. And then building public health infrastructure within the state and local health departments. We realized that we had become very, very slim on our epidemiologists, on our health educators, on our communications team. And that was throughout all of public health. So Arizona has a decentralized public health system. So not only was that at the state, but it was also at the county level. And so providing resources so that they have adequate resources that they can respond. We had to staff up significantly for contact tracing and case investigation during that. We brought on hundreds of people to be able to do that. But then the other thing is laying that foundation for the future. So working with community colleges to potentially develop a public health practice curriculum now that they're able to do 4-year degrees, so that maybe we can get more boots on the ground and more people interested. We're going to seize on this opportunity that people actually know what public health is now and that it's an exciting field. And so let's get some of those younger people who are just entering college excited about entering into public health to increase our workforce.
Do you think, you mentioned the decentralized nature of public health in Arizona. Do you think that this experience and these new infrastructure investments that I think many recognize need to be made, do you think that that augurs for a more centralized public health system, or at least some parts becoming much more centralized? What do you think?
What we identified was that it was really good to have a range of responses. So normally contact tracing would happen at the local county health level. They're responsible for case investigation and contact tracing and follow-up. That's historically been, but it's usually with STDs or with very few other infectious diseases. What we identified was by having a central repository where the counties could let us know which cases they needed help with, allowed them to continue to maintain control of those investigations, but to get assistance from the state in whatever ways they needed. So we identified that having some centralized services that could help the counties on their identified needs was really beneficial. So we are looking at building that type of infrastructure to support our county health departments.
Vernon Smith asks if you could say a little more about how your agency or the state in general will be working to address some of the social determinants that you mentioned in your comments.
Yeah, absolutely. So part of our Arizona Health Improvement Plan is looking at health in all policies, as well as those social determinants of health, because we know that you can't be healthy if you don't have those basic things that you need to live, such as food, housing, transportation. And so one of the focus areas that they have looked at is the housing portion for social determinants of health. So they've built out a 2-year plan as part of that Arizona Health Improvement Plan to increase access to affordable housing and to help Arizonans stay in their homes by identifying financial and other community resources. And then that will be the building block for other social determinants of health. And one of the things with that Arizona Health Improvement Plan that we will be working on is focusing on health equity and ensuring that all Arizonans have equal access to healthcare opportunities that allow them to be the healthiest they can be. And so that will be not only is it its own section that we're looking at, but it's also a cross-cutting through all of the other priorities as we look at it. So as we look at pandemic recovery, we're going to be focusing on health equity. As we look at rural and urban underserved areas, we're going to be looking at how do we increase health equity in those areas. And so a lot of that will also be taken a look at as we look at our social determinants of health.
Well, you've been very gracious and generous with your time. I want to ask you just one more question, and that is, what gives you hope about where we sit today in May of 2021? What kind of gives you, kind of inspires you to keep putting one foot in front of the other and gives you hope about the future?
I think the thing that gives me the most hope is how the community came together during the pandemic and the partnerships that now are going to be sustained beyond the pandemic. Everyone was willing to help. Everyone, when we called, there was no hesitation. They would just pitch in, what do you need? And they were just right there with us throughout, the whole pandemic. When I think back to testing, how Sonora Quest was a huge partner and ASU was a huge partner in developing new testing platforms and strategies to make sure that we had capacity. And then as we were opening up testing sites, Blue Cross Blue Shield, Arizona Complete Health, the Arizona Cardinals, they just stepped up and were amazing. And I think that gives me hope, because while you hear that there's a lot of disagreement, with political and with vaccination and all different types of issues in Arizona, when it comes down to it, the collaboration and the cooperation in Arizona are still alive and well. And I think that bodes really well for our communities moving forward.
Dr. Cara Christ, the director of Arizona's Department of Health Services, and of course, public health voice for the state. Thank you very much for making time to be with us. I appreciate it.
Thank you for having me.